All right. Good afternoon, everyone. I'd like to thank you for joining non-college for our second session of our pandemic relief seminars. When we did our initial one in the fall, we enjoyed it so much and we found it to be so educational that we did not want to stop with that first one, but we did want to continue on with talking about topics that are relative to the coronavirus, our community outreach, and also our personal health. So today we're going to talk about a little bit how COVID-19 has influenced, our health decisions. Next slide. So right now, we've had over 500,000 deaths attributed to the coronavirus. Now, that number has not been as rapid as it was in the past due to better preventative measures now that we're getting vaccinations. However, we're still seeing some of these higher rates of infection in certain cities across the United States and even in our local community. And so now we're trying to figure out, how do we balance life before COVID versus going through this COVID versus what happens when we get on the other side of this pandemic? That has probably been the biggest question that has been on everyone's mind, is where do we go from here? The second question that usually pops up is, how do we get there? And the bigger questions that always come up between that who, what, why, and how is what helps us set the stage for how do we eventually come out on the other side of this pandemic. We look at certain things and we know that, a lot of situations get very touchy, and we know that they are very sensitive, to people. And so the world of public health acknowledges that sensitivity. It acknowledges that raw emotion. It acknowledges the unknown. It acknowledges that confusion. And so as we are moving, we're looking at how do we find plausible solutions as we continue to walk through this together. Next slide, please. So for most people, we look at science, and that's been the biggest conversation that we've had. Oh, we don't like X person. We don't like Y person. We don't like the information. We don't like, well, public health and health in general, it's a science. And so with it being a science, it must be in our minds to understand that science is not always right. Science makes mistakes. Science has to make mistakes to see how to get things right. And so that is all a part of, testing and going through things very similar to the scientific method. For those that are biologists or very hardcore into the sciences, that you will state a hypothesis, you'll get out there, you will observe it, you will test it, you will see the results, and then look to see how the results mirror back to your original hypothesis or your original questions. Now, does that mean that 100% of the time it's going to be spot on? That answer is no, because this virus has been so tricky and it has been so complicated in even looking at transmission and curing and really trying to get our collective arms around it. It's almost sometimes like holding water, and it just slips through our fingers. And when we think that we have it, it just slips through our fingers. But now we're on a better path, because now we're looking at how do we take this science, though it may need to be tweaked every now and then, and get us to yes. Get us to yes, this is going to work. Yes, this is our direction. But science has become mixed up. It gets mixed up in politics. And so I have a famous saying, and I say that when health becomes political, everyone loses, because it sets up our stage to have a severe lack of trust. We have to trust those physicians, trust those virologists, have a lot of trust in our medical system. But at the same time, we have to have a lot of faith and trust in our politicians as well. And so how do we marry those two things together to ensure that health, the people, and the science are all walking down the same path. Now, that does not mean that everyone will always agree in lockstep. Because we're on the same team doesn't mean we can't have different views. And I think that becomes the most pertinent piece of this whole situation. Because we're on the same team doesn't mean we have the same views. And so what that means is there's room for improvement. That means there's room for change. That means there's room for conversation. There's room for discussion before we get too high on our ladder of inference and think that we are the sole authority with the sole answer, with the sole plan. Sometimes it's good to have that open window of dialogue and be able to take in that silence where we're both internalizing what that other person is saying to really understand where we need to be. And so why do people have this big difference? Well, it's because we make decisions based on our own personal beliefs. And in public health, we have something called a health belief model. And it is 5 constructs that talk about, how do you look at this problem? How do you perceive this problem? How do you think this problem affects you? Do you think that you have the ability to think and work yourself through this problem? And then are you willing to make the change? And so all of this is where we are. But this is where we've gotten so jumbled because we're really trying to figure out how do we put these 5 constructs in this model into action, but yet make sure that we're not trampling on one person in spite of the other. And so that is exactly what we see right now. Pick an issue when it comes to COVID-19 right now from a health standpoint. Whether or not we should social distance, whether or not we should continue to wear masks. We're looking at now vaccinations. We're looking at the efficacy of the vaccination, or how well does this vaccination work? And then how do we get it to the people who are most in need? Next slide. So it is imperative and very important to know that, the role of public health, in this stage is to inform people and protect people to the best of our collective ability. That means that everyone may not always agree, but it's like going to a fast food restaurant. When you walk into a fast food restaurant, you are assuming that the food that you're going to receive, 1, edible, 2, safe to eat, and 3, disease-free. Well, how does that occur? Well, someone comes in and inspects the cooks. They inspect the workers. They inspect the restaurant. And so even with this COVID, we are inspecting the store. But what we don't really understand is the store changes. The menu changes. The virus changes. And so when we try to pin it down on one side, it pops up on another. Very similar to the South African variant, the UK variant, and all of these variants that are now here in the United States. That is what we look at. And so a lot of people, when it comes to, public health, there are 3 things that often come into mind. Packaging, promotion, and being able to get this message out and through proper planning. So those 3 P's of planning and getting good program implementation is what we look at. But we just have bad optics because people have become so polarized on this issue that the good news gets swallowed up often by the bad news. It gets swallowed up by the channel. It gets swallowed up by the person. It gets swallowed up by the situation. And so when those emotions begin to run high, the ears begin to hear less and less and less until you really don't want to hear anything but stand on whatever principle that you feel is doing and being the best. So the question of the day is, then what do people do? How do people maintain their health even through this situation? So right now we know that we're in our vaccination stages. But, we're still encouraging people to maintain, proper social distancing, to maintain wearing a mask. Now, anyone who is a real person will admit and to their face that they do not like wearing a mask. There is no one that's going to stand up and say, hey, I want to wear a mask 24 hours a day, 7 days a week, 365 days a year. However, if we explain to you that this might prevent us from, instead of going 365 days, we might go 180 days, or we might go 120 days, or we might go 240 days. Would it make a difference? And that answer is yes. But it all gets down to this one simple word. It is communication. Next slide, please. So as we look at this situation, our desire is to get back to some semblance of normal. We want to get back to going out and having parties and social life, because as I stated before, we are social people by nature. We don't want to sit and curl up in our houses like hermits and not being able to enjoy the sunshine or go for walks or enjoy our families. Those are the things that we strive for. Those are the things that give us the purpose that we need to move for. And so now our new rollout of our vaccination program, it is what's going to help us as a community, us as a people, us everywhere, be able to get back to that sense of normal. But this message about this vaccine, it's hope. This is strength to give us the courage to continue to move on, to continue to take each other by the hands and walk together towards a plausible solution. This is what we have to do. This is what we must do if we're going to get through this pandemic, not just here in the Knoxville community, not just here in the greater Knox County community, but this is something that's going to affect every person in the state of Tennessee. It's going to affect every person in our region. It's going to affect everyone in our country. How do we do? The next slide. So as we look at what do, we have to understand what factors and problems do we still face. We're still facing those socioeconomic problems. We're still facing, the racial divide in regards to vaccines and the programs, and the mistrust of people not being able to or wanting to take the vaccinations. So we still have a little way to go. But it's going to take the village to bring us all together. We know that there are conspiracy theories out there that, you're getting implanted with microchips and, you're just a test dummy for whether or not this stuff will kill you, or there's so much misinformation out there that people sometimes readily accept more, even though it has become over sensationalized. Most of it, majority of it, 99.9% of it is further than the truth. And so we have to make sure that the messaging that we're putting out to our people is a secure message, is a respected message, is a well thought out group message, to make sure that we are all thinking and moving on the same stage. Next slide, please. So what do we do? If we're driving in this car, are we going to stay on the road, or are we swerving to avoid every pothole that we see? And right now, we still have difficult decisions regarding whether or not people who believe that if this is a real virus, if this vaccine is real, if it's really helping people, is it just a test? Is it just, there's so many different avenues that we're facing and that we're bumping up against right now, that we must find plausible ways to have good movement. And so health is a community effort, and it's up to us to encourage each other to maintain having healthy practices. It's going to be up to us, and I say that because Public health recognizes the emotion, the feelings, and the thoughts. But I'll take it a step further. My name is Keith Lindsey, and I contracted COVID. I was in the hospital. I had the doctor tell me that, hey, if we have to put you on a ventilator, you might not live. This is the reality that we face. So I'm not talking from a hypothetical standpoint. I'm talking from a real life situation where you're laying in a bed with tubes and getting x-rayed and getting poked and getting prodded for them to fight for your life. And they tell you, maintain good thoughts because you have to fight this battle by yourself. You don't have anyone that can support you in that room. It is you and your body fighting. And so, yes, because of that, it will spark better conversation because we can't disregard someone's emotion. We can't disregard someone's feeling. We can't just brush it aside and think that it's just a mindless drivel. But at the end of the day, we must be willing to accept those different opinions and use those opinions to come up with some kind of consensus that everyone can live by. Those are where we have those better conversations, where we're not fighting each other. I stand in amazement that we fight each other to try to help cure each other, to help support each other, to make sure that this goes away. But we're fighting each other because we don't know what stance to take. We don't know what message to believe. We don't know what platform to stand on. But this is where we're going to have to come together, continue to sit down at that table and have those difficult conversations that, yes, it will get us somewhere. That's the big thing. It's almost like negotiation 101. It's going to get you there. But how does that work? And the next slide, please. So it works by having better awareness, better programming. We look at our national preparedness. Do we have a local preparedness, a plan? What happens when we have things occur of this nature? How do we implement the best plan possible to protect the community and all of its citizens, from the top to the highest person to the least person? How does public health, how does our government, how do we have a plan put in place that spurs communication? So that communication is like a waterfall. It starts at the top and it flows down to the people. So it starts with our leaders. It starts with everyone who sits around these tables who hears this information. How do we come together to bring our people together? Not to separate us, not to have one set of standards for one side of town, separate set of standards for this side of town, or for an individual or a person or a group. But how do we come to that consensus that protects us all? There's a happy medium somewhere. We have to be willing to sit down at that table and find that happy medium. And that comes from increasing the awareness, helping people understand what we're going through. Because a lot of people to this day, they still don't understand this. They don't understand the reasoning and the rationale. Why? Because it's not really being told to the people in a way that they can understand it. Sometimes we just talk over people's heads. We have all this information and we just start firing out words. We start firing out situations and we leave people behind because sometimes they don't understand what we're trying to say. So we have to do a better job at making sure that this awareness and these guides and programs that we put into place can be the most effective to reach the most amount of people in the spaces and the communities in which we live. Next slide, please. So we're either going to do this together or we're going to lose. There's no simple solution to this. We're all going to pull the sled together or we'll go nowhere. We're going to row the boat together or we get nowhere. It's almost like watching a row team. You know, you have your coxswain that's yelling, urging you to stroke, urging you to push, urging you to move. But those rowers have to move in sequence. And it's beautiful to watch. You know, if you've ever seen a row team, you know, row those boats, and just how much force and how much power they get behind those strokes as they're moving and they're moving and they're moving and they're moving. We are no different. We have to find a way to get in that boat, no matter we're all different sizes, we're all different shapes, we're all different colors, we're all different everything. But at the end of the day, that oar is the same size. That boat is the same size. And no matter how big or small you are, we're all going to have to get on that oar. And we're all going to have to row together if we're going to make it through. That is the future. You know, that is the future not only of public health, but it's the future of dealing with this coronavirus. We have to look back, recognize the mistakes that were done. It wasn't perfect. We've got to realize, hey, my son always says, Dad, mistakes were made. And so we have to realize that, yeah, mistakes were made, but it doesn't mean that they are our anchor. We can use those mistakes as life preservers and use them to help us move to where we need to be. And so that takes a lot of humility. It takes a lot of self-focus. It takes a lot of looking inside of ourselves to say, look, I'm not perfect. I don't have all the answers. Help me. Give me some advice. Give me some counsel. How do we do these things? And bring that community together. So that way, no one feels left out. That is the main goal of public health. It is to make sure no one gets left behind. It is to make sure that the least of those in our community are able to access services and hear information and receive information that could possibly save their lives. And so even today, we're looking at how do we save lives? You know, we ask the question, are we our brother's keeper? And that answer is yes, because we are a community. The community is not one person. The community is all of us. From the lightest skinned person to the darkest skinned person, from the richest person to the poorest person. We are all community. And more importantly, we are all this family. And yeah, the families have fallout. We're not going to say that doesn't happen either. But at the end of the day, we realize that the family might disagree, but we're going to disagree and continue to love and support each other because we're family. And that is where we're having, and we must turn this page to. Next slide, please. So as I close, health is extremely personal, yet it takes the whole community working together to make this a reality. In other words, if you want to see change, you must be the change agent. You must be the change that you want to see. You must inspire someone to be that influencer or change. When we do that, and we truly, truly reach out to each other, and we truly do that in the spirit of compassion, in the spirit of mercy, in the spirit of love, in the spirit of education, in the spirit of just getting together, not to sit around and sing kumbaya and think everything is perfect. But how do we take those differences, put them around the table, negotiate them out, and get to yes? That is what we look at. That is our challenge. That is our goal. And so as we move through this health situation, as we continue to move through it through these coming days, don't be discouraged. Be encouraged for the movement that is happening. It is a good movement. But now we have to take the time to embrace it as a community, see what we've done wrong, make that wrong right, and work together, work together, work together to make this become a reality. So I thank you all for the time this evening, and I hope that this has inspired someone to look at how we can create good change, positive change in our communities, so that we can work together and beat back this COVID as a family.